Brandon. Thank you for being with me on this episode of AD in Focus, where we're going to talk about digital health. And first off, why don't you start by you introducing yourself and then telling me what you feel the coronavirus has done in impacting digital health adoption in the region?
Well, great to be with you. Thanks for having me today, first of all. So my name is Brandon Rowberry. I'm the CEO of Digital Health for Aster DM Healthcare. We're a large provider, hospitals, pharmacies, clinics here in Dubai and throughout 7 countries in this region. As far as what has transpired with digital health and the coronavirus and the adoption rate, what we saw during really those peak 2 years was a rapid increase in people getting remote care, right? Doing video consultations like you and I are doing right now, trying to access healthcare when you couldn't be physically there with a person. It ramped up, 40 times, 40x where it was. What that did was it gave people an opportunity to experience something they perhaps had not experienced before, and that is meeting with a doctor when you're not physically present with them. Now, that doesn't mean that everyone's going to do that in the future or even now. What that means is once you go through a few experiences of that, you go, oh, that wasn't so bad. Maybe I can do that again in the future. And maybe for the cases of health for me and my family that would make sense, maybe I'll do that even more. But let's not just talk about, it's not just about teleconsultation, as we call it in the healthcare industry.
Yeah.
It's also about the ways you can get your pharmacy and medications in a more remote way, right? Delivered like a consumer product to your home with the right controls and measures in place, as are with prescriptions, which we're moving forward with here in the UAE and throughout the areas that we serve, as well as many areas in the world. What was needed for that was a change in the rules, right? A change in regulations to allow that to occur. Because what happens when you get a prescription at a doctor, right? You get it and it physically is in your hand. And you walk it over to the pharmacy and the pharmacy fills that, and then and they check it. The pharmacist talks to you exactly about what's going to happen with those medications, and then you go home with it. Now, if you're doing a teleconsultation with a doctor and you get your prescription from the doctor on your app, then what happens? You can actually get it delivered to your home. However, in order to get delivered to your home, the same rules need to be followed in terms of making sure that's safe. The medications aren't going to have any adverse reactions with other medications that you might be taking. And of course, since it's a substance that not just everyone can have, those controls can happen. That is in place right now. That didn't used to be the case. Those regulations have come up to speed to allow that to happen. In addition to that, there was a rapid increase in the need and ability to do remote ICUs, right? Intensive care units. Normally, that's right inside a hospital. That's where the most critical care happens for people that are really sick.
Yeah.
But when you don't have enough doctors and nurses to go around to make sure that those patients, right, during COVID, the peak of COVID, there was a shortage.
Yeah.
It was really difficult. And so Aster, as well as many other great healthcare providers, stood up ICUs that were not in hospitals, or those that were in hospitals, and gave an ability to remotely be part of that experience for other doctors elsewhere, so they could monitor those patients and provide the kind of care that they needed. Now, we can do that as well now. What that took was quick action by governments to say this is okay. And it's okay to do across borders as well. Now, what those governments are saying is we need to pull that back just a little bit and make sure the rules and regulations are being followed. We can still do that within certain guidelines and boundaries. And we're moving ahead with that opportunity, let's say for remote areas that have less access to care, for peak conditions or peak periods where we may have that as well. So there, digital health means a lot of different things. Now, what we're also seeing, now that COVID is kind of tailing down, is the level of teleconsultations that is going on, right? Talking with the doctor on a video call is stabilizing up, right? It's certainly not where it was at the peak. And nor is it where it was before we started COVID, right? So there's a higher
adoption
now.
Yeah.
Higher baseline, greater adoption than what we would have assumed. Without COVID, you would have said, well, we're going to be 2 years further now than we were before COVID in terms of the adoption rates.
Okay.
What we saw, we've seen a pretty dramatic uptick in where we thought it might be, as well as people's adoption of that. Now, that's not to say that everyone's going to do it. Every case is not appropriate for a teleconsultation, but those that are, wow, what an opportunity to not have to take a full day off work to help to manage your child's condition once a month, every other month, and just be able to do it in this new way for people. What a fantastic opportunity for our patients.
Yes, we spoke about the opportunities. Let's look a bit about the challenges that remain despite all this progress. And you touched on it a bit, but if you can elaborate, like what's the role of the government in that sense, or the regulatory bodies in overcoming whatever challenges you're going to outline?
Well, so the regulatory body, I do have to tip my hat to the regulatory bodies here in the United Arab Emirates, particularly in Dubai. They've really been on top of it and kind of very progressive about pushing that forward. In fact, the Dubai Health Authority, for example, here has a whole digital health office where they go through and they want to partner together to understand what are the new solutions that they can bring to the table. So that's great. The things that they had to react quickly to during COVID were some of the rules and regulations that restricted some of the remote access, cross-border things where they basically essentially just said, look, we need to save people's lives right now. And if this is getting in your way, we're happy to remove that for a while until things stabilize and then be putting back in place. Now that things have stabilized and putting that back in place, what we found is that the government has been progressive in terms of what other things can be done in a digitally enabled way to meet the aim of healthcare, which is providing better care, greater access, and greater affordability. You see, part of digital health is about, it is a less expensive way to provide some of the care we have today. It's also a much, much more accessible way. For example, if you need to get care in your home, instead of coming into the hospital, digital health can help you with that and our technologies. If you need to do a teleconsult, obviously digital health can help you with that. If you are not near, if the closest pharmacy to you is many, many, many kilometers away, and you can get things delivered to you, digital health, again, can help with all of those things.
Okay. But in terms of the challenges, do you see any challenges to the adoption of digital health in the region?
Absolutely. There's still challenges to the adoption of digital health. Most of them are behavioral in nature, right? You and I wanting to do things the same, that we have done this in the past. So what you see is it's similar to the digital adoption rates with any other industry, meaning you find that, from the older, middle, and younger generations, the younger the generation, the more comfortable they are with the technologies and the kind of the behavior needed to adopt those, and they adopt them a little more rapidly. You also have some challenges in terms of the healthcare system itself, right? So you've got doctors, for example, who've been practicing for many, many years. And sometimes those doctors aren't really interested in changing to a perhaps different model because they may only have a few more years left in practice. Some of the younger doctors or those who specialize in things that that digital health is a little more on the cutting edge of, that's where you find the greater adoption rates as well.
Okay. And within that context, what do you see as the future of digital health, and where are the opportunities that may arise like in a couple of years?
So I think the future of digital health,
maybe just globally if you want.
Sure. So I think the future of digital health is a lot more of some of what we're seeing today, meaning a lot more of the opportunities to do things remotely, a lot more of the opportunities to integrate data and information in ways we haven't had an opportunity before. So for example, people in digital health all the time, and this is for many years, right? I was working on this 15 years ago. Hey, we've got these Fitbits on my arm. I've got all these devices. Can't the doctor just have all my data and then tell me how to be healthy, right? And what to do with it. The problem with that is there's such a torrent of data that's possible, but the insights don't always come along with it. And if you want a doctor to be able to just sort of sift through all that various information and make sense of it, that's pretty difficult until the intelligence of it comes on and says, well, because you're behaving in this way, and because we're getting these markers off your body and et cetera, what is that going to do for you? We're now actually seeing an ability to make sense of those things, add insights to that, and to prepare and enable the doctor to help you out to keep yourself healthier. We're also seeing obviously a large adoption in digital health technologies that don't necessarily connect with the doctor, but help you and me live a healthier life anyway. And isn't that the aim?
Yes.
Right? We all wear a lot of these things on our wrists, have various other devices that help to keep us healthy. Some of them integrate with our healthcare providers to help us provide that care, but a lot of them as a consumer integrate with where we are. So I think we're going to continue to see a lot of that. You're seeing some of the very large tech companies, right? Google, Apple, et cetera, who have bought in and have actually bought a number of those companies. I believe Google owns Fitbit right now, and they're trying to understand, hey, how do we make this wearables platform so that we can make that integrated with the health system to enable better care. And you have a number of companies doing that as well. How can we enable, for example, the other thing we'll be seeing is a lot more artificial intelligence and machine learning in all facets of healthcare. For example, people like to talk about radiology, or we'll call it medical imaging, which means the scans, you get a chest scan, and it looks for what it looks for in terms of, are you developing a cancer? Are there any issues in your lungs, et cetera? The current algorithms that run there are getting better and better almost by the month, right? At actually identifying those things vis-a-vis a human doctor who's looking physically at every one of those scans to see where they are. If the algorithms can enable the doctor to be more efficient and more effective at doing that, what a wonderful thing. And also that means that the doctors can get more and more specialized on just the most important things and leave all the efficient things that can be done to the machines that can do them well. We're seeing rapid adoption in the provider networks around the world, globally, of that. Images are some of the easiest use cases for that. And that's why we're seeing that kind of take off like wildfire. There's many other things. So all of the data that gets stored and captured around people, and the ability for us to understand how to provide better care across geographies, across ethnicities, et cetera, also is gaining steam very significantly. And fortunately, we're kind of right in the middle of all that. And I think you and I and others will be the beneficiaries of what comes out of that.
How exciting.
Yeah, it's a very exciting world. And a lot of people are getting into it. As well, from all kinds of different industries. It's very exciting to see the kind of digital talent that is joining healthcare to help us solve some of our toughest issues.
Yeah. Okay. Thank you so much for your time, Brandon. I don't have any more questions. Is there anything you would like to add that I haven't touched upon?
The only thing we'd like to add is that health, if there's great talent out there that needs to find a sort of mission about doing things, healthcare is an interesting and exciting place to be. And if you are mission driven to helping people out, you should check out what opportunities there are in the healthcare arena, particularly for digital talent engineers and things like that. It's pretty neat to be able to tell your kids and your grandkids that you're doing something to help and change the world, and it's your job too.
Yeah. Okay. Thank you.
Thanks, Eva. Pleasure to talk to you. Thanks for taking the time today.